Ladies and gentlemen, there is a nursing shortage in America that is only getting worse as COVID continues to explode around the country. These nurses are tired, they're burned out, and many of them are now walking away, which could mean a lot of trouble, especially as these surges keep increasing. And we know they're going to increase because of the holiday. So I have this article from NPR, The Economics of America's Nurse Shortage. This is December 2nd, 2020.
All right, and support for this podcast and the following message come from Little Passports, offering activity.
All right, as soon as this is done, you know how it is. Okay.
NPR. Adam Johnston is an emergency room nurse. You just got off an overnight shift. Yeah. Adam has been doing the job for 7 years. He works in Fargo, North Dakota. And what are North Dakotans like? We have a lot of, I think, stoic, rural population. We talk a lot, like if their presenting complaint is my wife made me come into the ER, there's probably something really wrong with them. Like they're probably actually pretty sick. Of course, Adam's job changed totally 9 months ago. The hospital got ready for a huge surge of COVID cases, and Adam was put in charge of the inpatient COVID unit. He says they saw some cases and some very sick people, but they never saw the huge surge they had prepared for. But, he says, starting in the fall, they started to see more cases and more cases and more cases. We're seeing patient volumes that are just beyond anything that we've ever seen before. North Dakota has seen COVID cases spike in the last couple of months. 1 in 10 residents of the state has gotten sick. And North Dakota has the highest COVID mortality rate in the country. Adam says the hospitals are overrun. Facilities are adding hallway beds to their ER to be able to see more patients. Like there are patients out in the hallways. Yeah. In bed, like in beds. Yeah. And what is the staffing situation now? It's getting rough. It's getting rough. All across the country, hospitals are reporting staffing shortages. There just aren't enough nurses to meet demand right now. This is The Indicator from Planet Money. I'm Stacey Bannock Smith. Today on the show, the nursing shortage. All over the country, hospitals are desperate for healthcare workers, and there just aren't enough to go around. And now some states, like North Dakota, are resorting to drastic measures. This message comes from NPR sponsor Avalara, providing cloud-based sales tax solutions for businesses of all sizes. Avalara automatically integrates with more than 700 ERP and e-commerce systems. Learn more at avalara.com/indicator.
Support for this NPR podcast and the following message come from Vox Media and its new podcast, Decoder, with Verge editor-in-chief Nilay Patel. Decoder explores the future of business and tech with business leaders like Salman Khan, David Chang, and Mark Cuban. Find Decoder wherever you get your podcasts.
In the early days of the COVID pandemic, hospitals were scrambling for equipment, masks, gowns, ventilators, things like that. Now the problem is people. J.B. Silvers is a professor of healthcare finance at Case Western Reserve University.
Now we've got PPE. Now staff is the constraint. So I think going forward, that's going to be the big issue across the country. And you can't manufacture more nurses. It just doesn't work that way.
JB has spoken with nurses all over the country, and he says, simply put, they are exhausted. Months of double shifts, PPE protocols, changing information, patients dying, and the constant fear of infection. He says it is taking a huge toll.
You see people leaving.
People are quitting. They're just quitting.
They're just quitting. They're saying, that's it.
I mean, how big of a problem is this?
Oh, I think it's huge. I think it's really big.
JB says as the supply of nurses is shrinking, demand for nurses is skyrocketing. So-called traveling nurses are typically the reserve supply for disasters. They go wherever they're needed. But right now, they are needed everywhere. And hospitals, senior centers, and nursing homes across the country are madly competing for nurses. There are reports of hospitals offering $6,000 a week to lure them in. JB says that is creating a crisis situation, especially for hospitals in rural communities and low-income areas. They don't necessarily have the money to bring in reserves or to even keep the nurses they have. At the same time, they're seeing a flood of very sick patients. States like Mississippi, Colorado, and Missouri are desperate. In fact, the hospital staffing situation in North Dakota got so bad that the governor, Doug Burgum, announced the state would be taking a pretty drastic measure.
So today we took a step to help address the staffing issue with an amended state health officer order that now is going to allow asymptomatic COVID-positive healthcare workers to work in COVID units of licensed healthcare facilities.
In other words, nurses and doctors who test positive for COVID but aren't showing symptoms are being asked to keep working. Adam Johnston, the emergency room nurse in Fargo, says he could not believe it when he heard this.
It feels like nurses are being sacrificed.
What was especially troubling to Adam and his colleagues was that North Dakota hadn't taken many other measures to contain the COVID-19 outbreak. There was no mask mandate, no ban on indoor dining or large gatherings.
We said, well, where are the prevention measures? It felt like this concept of thank you heroes was tossed by the wayside. We, through the first several months, we saw lots of signs, thank you healthcare heroes and people on the news and in public, and there was a great strong outpouring of support.
Oh, yeah.
And then I saw, so this is how we're going to combat COVID. We're going to put our nurses at risk. Now where is the recognition for being a hero in that?
Adam says this has made things even harder at work. Feels like there's no place to relax because even the staff break room is potentially full of very sick people. You cannot let your guard down at all. Adam heads North Dakota's Emergency Nurses Association, and he and other healthcare workers spoke out after the governor's announcement. And the governor has since issued a statewide mask mandate and has limited gatherings and indoor dining. Adam says he truly appreciates that. Still, he says, these days his job is just really hard. So what are your days at work like now?
It's exhausting. I'm an ER nurse. I like results. I like to see patients get sutures and go home. I like to see us, do CPR and revive people. I'm very results oriented, and to go to work every day and just say, who's going to die today is not what I signed up for.
And Adam says the risk of physical and psychological burnout is always looming. He says he used to be able to leave his job at work. Whatever happened during a shift, he could always leave it at the door. It was a key to avoiding burnout as a nurse. Now, Adam says he just can't. There are all of these moments that haunt him. He says he keeps thinking about this one COVID patient who was getting sicker and sicker, and Adam knew he was dying. So he called the man's emergency contact so he could at least have a FaceTime moment with a family member or a friend before he passed.
There was a phone number there listed for a friend. And so I called that friend and said, hey, do you have contact info for his family? And he says, there is nobody. It's just me. I live next door, and
I go over there now and then and check in on it. And so that for me was just sort of the epitome of seeing somebody that just died alone from this. Yeah. And just like very alone, like no FaceTiming, none of that. It just sort of put into perspective how really truly painful it is to witness that happen. Yeah. So that's one patient that I can't forget. I think about him a lot. This episode of The Indicator was produced by Jamila Huxtable, fact-checked by Sean Saldana. The Indicator is edited by Patty Hirsch and is a production of NPR.
All right, y'all. You know, if you're a nurse, I know it's been rough because I have a few in my family and they are wiped out. So I know how bad it is. And plus, I've been looking in the comment section at what some of the nurses that are subscribed to me are saying, and it's pretty much mirroring what my family have told me, the ones that are working in hospitals. So it's not easy. You got to look at sick people and people dying all around you day in and day out. Psychologically, that would take toll on anybody. And these nurses are not getting breaks. I've listened to multiple videos where they're saying they don't even get a break. They're working through breaks. They get a lunch and then it's back. And you're talking about nurses that have been working double shifts since March. Okay. That would just drive anybody crazy. So I understand how they feel. It is hard to do what they do, especially under these circumstances. And it's really not entirely their fault at all. You know, you spend all that money in nursing school and you have no training in pandemics. So these nurses can only get on the floor with what they do know and do the best that they can. So, wow, if you are in that circumstance, man, I pray for you because that is rough. I mean, most of us that are not in nursing through a pandemic, we can't even imagine what you're going through on a regular basis. But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.